Smallpox and monkeypox are part of the same family of viruses. So this is a virus. This is usually found in Central and Western Africa. It hasn't made its way over to the United States in some time. The last time that we had a situation like this was in 2003. There were 6 states, about 47 people were infected at that time, and then since then we haven't really seen it. In fact, it's been rendered eradicated in the United States prior to that. Over the last probably 10 months, we now have 4 cases in the United States with 1 presumed case here in Broward County that was just identified, is undergoing investigation since yesterday. What we know about monkeypox is that it is transmitted through close contact with someone who is infected. So once you make that close contact with the individual, then it takes about 3 days after that contact. Fever usually ensues, and then it was followed by a rash. The rash is very different, although it looks, in appearance, it looks like chickenpox. It's very different in its distribution. So chickenpox follows a very linear kind of pattern rash, generally on the trunk, on the upper, in the front or in the back. So monkeypox follows a very different distribution. It usually starts on the face, the head, could start in the mouth, and then it sort of cascades down the body. People are most contagious during that rash period, and that's what we tell people to look out for. Fever, chills, the rash, and some swollen lymph nodes really anywhere in the body are things that we want folks to take note of. None of those things, by the way, in and of themselves mean that somebody has monkeypox. We know that you can have swollen lymph nodes when you have a viral infection. A flu can give you all the same kinds of things. What's a little unusual is adults with a rash. We see this in kids sometimes, but we don't see usually adults with a rash. To prevent this, you want to stay away from folks that are infected, of course. Similarly, one of the preventive measures is to stay away from infected foods. Generally, we're talking about things that have to do with infected animal, like monkeys, rodents, small prairie dogs. These are known vectors for monkeypox. We don't want the public to be alerted to the fact that they should not seek medical attention if they're an adult that has traveled outside of the country in the last 3 weeks and they may develop a fever or a rash. In that case, they should call their physician and ask the physician for what the next best steps are. They don't need to stay at home if they think that they've been exposed. Make that first call, and we're ready to take care of those patients at Broward Health, like our regional partners are as well. Some of the measures that we take are the same measures that we would take during this COVID era. It's the mask, it's the respiratory isolation room, it's hand washing, it's gown, gloves, and eye protection. We have all of the same supplies available at our emergency rooms to take care of folks that may be infected like this the same way that we've been doing with COVID.
Can you compare it to COVID as far as how infectious is it?
Yeah, significantly less infectious than COVID. COVID is quite rampant across the world. It is a pandemic, as you guys know. You've been covering this for more than 2 years. This is extremely rare. Like I said, the last time that we saw what would be considered an outbreak in the United States encompassed 47 people in 6 states. So more than 47 people will be infected with COVID today. So it's extremely rare. Something that we should be alert for, certainly, but nothing that we should alter our lifestyle about right now.
And how dangerous is it if you get it?
And more dangerous in people that have a lower immune system, that may be taking medications that lower their immune system, or that have disease states that may lower their immune system. But even in a third world country that has this, the mortality rate is 10%. In the United States, that we didn't see anywhere near that 18, 19 years ago when we last saw it here.
Yeah, chickenpox, is it protective against monkeypox?
Chickenpox is not preventive against monkeypox, although that virus, the chickenpox virus, is in the same categories, in the same family as monkeypox. But what we have found is that folks that did get the smallpox vaccine have some protection against getting monkeypox because of that familiarity.
Dr. Lanchas, when you're saying that this is less transmissible, it's a little less, it's less going to the community, less
It's easier to contain because of how rare it is. So we employ the same kind of contact tracing mechanisms and methods that we used during COVID when one is exposed to someone else and then they get that. So in the early days of COVID, we did a lot of that contact tracing. We do the same kind of contact tracing. If this presumed case in Broward County does wind up being confirmed, then the Department of Health and the CDC will go through that same contact tracing in order to provide those kind of mitigation measures to contain it.
And this isn't starting from scratch like we were at the beginning of COVID, right? There are already treatments that exist for this. So if someone does come in with it, you guys have something to treat them.
So you're correct. This is not like starting from scratch from COVID. Yes, we've dealt with this before several times, number one. And number two is that you're correct in that early identification and diagnosis of this as monkeypox, there is some crossover, as I mentioned, between the smallpox vaccine and monkeypox, so we can give that vaccine to someone who is infected, and that will keep the symptoms much less severe. So you're absolutely right, yes.
Does this case, the presumed case, involve foreign travel, or is it
The presumed case right now, I don't have a lot of details. The Florida Department of Health and the CDC are working collaboratively to really drill down into the details of that case.
Is that patient being treated here? Were they administered into this hospital or no?
I can only tell you that they're working together to try to figure out exactly what's happening. I can't answer that question right now.
Do you stockpile antivirals for the vaccine? And can you also tell us maybe the order of what you would have to take? So I know with vaccines, you have preventative antivirals that you have found out you have it, right?
Yeah, so there are some, there is a medication, it's intravenous immunoglobulin that you could give to somebody who's infected to try to get them over in a more severe case. The ideal situation would be, because the severity is not as extreme for the general population, then just like chickenpox, the chances are that they are isolated for several weeks. The lesions, the rash will crust over, it'll fall off, and they could go about their life without having received anything. In the event that there is an exposure to that individual who is infected, then the CDC presently is looking at occupational exposures, high-risk occupational exposures, for the provision of some of the smallpox vaccine stockpile that the federal government has. Remember, in the United States, it was eradicated since the early 70s, so they have a small stockpile of the smallpox vaccine still that they can use and deploy in the event that that's needed. So between the vaccine and that IV intravenous immunoglobulin, those are really the two best things that we have presently to mitigate somebody from getting severe illness if they were infected.
All right, I think that's up for noon. Is there any other questions?
Do you want to talk about how
One thing, if you could clarify, I'm looking at the recommendation of vaccines for children and for school-age children. The chickenpox or varicella is part of that recommendation. So is it safe to say that most Americans, or at least in the state of Florida, would have this vaccine since an early age?
Not the chickenpox. The chickenpox, smallpox, and monkeypox are all in the same family. But there's more protection if someone had received the smallpox vaccine than if they had the chickenpox. The chickenpox is a little bit more different, even though it's in the same family. So there's no crossover of protection between the chickenpox and the monkeypox.
Do most kids have the smallpox vaccine? I mean,
Not since the early 1970s. We stopped. Yeah, we stopped community-wide vaccination of smallpox in the early 70s, and then it was deemed eradicated from the U.S. in 1980.
So there's another part of this which is controversial in it regards it's like sexually transmitted and it's a certain group of people. Is that something that we need to be aware of here in the public?
What I would say is that the transmission of monkeypox, we know it to be transmitted through respiratory droplets, so that's close prolonged contact. We also know that it's transmitted through bodily fluids and secretions. So if you have a lesion in your mouth and you're kissing someone else, and that person's infected, it is possible for you to get that infection. It can also be transmitted through linens, through bed sheets that folks may be on. So there's an indirect contact. So that's why we take the precautions that we take with respect to any potential infection.
All right, thank you guys. All right, thank you, doctor. Appreciate it. So we have a one-on-one that we need to get set up too.